Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Have you ever considered that removing your uterus before you turn 50 could raise your chances of a heart attack or stroke by more than 20%? Welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and alongside me is co-host Alara Sky. Today we're unpacking fresh research showing that hysterectomy can heighten your risk of heart disease, stroke, and metabolic trouble.
We'll guide you through the data and, just as importantly, share concrete steps you can take to keep your hormones and your heart in balance before or after surgery.
First, some context. A hysterectomy removes your uterus, ending periods and pregnancy. In the United States, about 600,000 procedures occur each year, and by age 60, 1 in 3 women has undergone one.
The operation once targeted cancers, but now treats chronic pelvic pain, fibroids, endometriosis, heavy bleeding, and prolapse. Many women face this decision in their 30s or 40s, sometimes losing both ovaries at the same time.
The long-running nurses' health studies revealed the stakes. Women who had their uterus removed before 50 faced markedly higher rates of heart attack, stroke, or bypass than those who kept it, even when estrogen therapy was prescribed.
For women younger than 46 who skipped estrogen, cardiovascular risk jumped 21%. Even with estrogen, the same group saw a 26% increase, proving that hormones alone don't erase the danger.
Risk persisted across almost every age under 60, hinting at forces beyond simple estrogen loss and challenging long-held beliefs about menopause.
A major Korean study backs this up. Following more than 135,000 women, researchers found hysterectomy boosted overall cardiovascular events by 25% and stroke by 32%, no matter the surgical method or hormone status.
2 mechanisms emerged. First, cutting key ligaments can reduce ovarian blood flow, triggering earlier ovarian failure. Second, without monthly bleeding, your hematocrit rises, thickening blood and encouraging clot formation.
Even when ovaries stay in place, the uterus itself seems protective. That insight urges careful exploration of alternatives before scheduling surgery for non-cancer conditions.
The Mayo Clinic added another layer. Tracking more than 2,000 women who kept their ovaries, researchers still saw higher odds of hypertension, cholesterol issues, arrhythmias, and, when surgery occurred by 35, a 4.5-fold increase in heart failure.
These differences didn't show up overnight. They surfaced 20 to 25 years later, right around natural menopause, implying that hysterectomy quietly shifts the trajectory of aging.
Why doesn't standard estrogen replacement solve it? The emerging answer is imbalance. Ovulation can falter after surgery, progesterone drops first, and estrogen becomes dominant, altering cellular energy and stress responses.
Unopposed estrogen raises intracellular calcium, hampers mitochondria, and fuels inflammation. A 2024 study reported up to 12-fold higher estrogen to androgen ratios in fat tissue among estrogen therapy users.
Strikingly, women not on therapy also displayed dominance. Progesterone to estrogen ratios sometimes fell into the teens, far below the healthy 200-plus mark.
That means the priority shifts from simply adding estrogen to restoring balance. Daily choices offer powerful leverage, and the research outlines 5 concrete actions.
First, know your prolactin level. Elevated prolactin typically signals heightened estrogen activity at the tissue level, making it a valuable indicator that something is off.
Watching prolactin becomes even more informative if your thyroid is sluggish, because high prolactin paired with low thyroid function amplifies metabolic strain and flags deeper hormonal turbulence.
Second, eliminate vegetable oils rich in linoleic acid. Seed oils, including soybean, corn, canola, safflower, and sunflower, permeate restaurant menus and packaged snacks, and each gram acts like a metabolic saboteur by mimicking estrogen and exhausting mitochondria.
Aim for fewer than 5 grams of linoleic acid per day, and if you really want to accelerate healing, push toward 2 grams. Reading ingredient lists and requesting seed oil-free preparation when you dine out helps you stay inside that range.
Dr. Mercola's forthcoming Health Coach app, featuring the Seed Oil Sleuths tool, will soon scan barcodes, grocery receipts, and digital menus to reveal exactly how much linoleic acid you're taking in, removing guesswork from your daily routine.
Third, become a conscious consumer of everyday products. Nearly 1,000 items, from scented lotions to vinyl shower curtains, contain endocrine disruptors such as parabens, phthalates, and bisphenol A. Swap conventional cosmetics for natural alternatives and ventilate rooms that store new plastics.
When it comes to food storage, choose glass or stainless steel containers and never microwave food in plastic. Tiny temperature spikes accelerate leaching and push xenoestrogens straight into your meal.
Filtering tap water, especially through a high-quality carbon or reverse osmosis system, or boiling hard water for 5 minutes, slashes microplastic content. If bottled water is your only option, reach for glass to avoid another hit of synthetic estrogen.
Fourth, rethink estrogen-based therapies and hormonal contraceptives. Oral, transdermal, or injected, they all contribute to your cumulative estrogen burden.
Fifth, consider natural progesterone as you transition through perimenopause or surgical menopause. Natural progesterone can temper estrogen's stimulatory effects and help restore a healthier hormonal ratio.
Implementing these measures may sound like a lot, but each builds on the next, creating a reinforcing loop that lightens cardiovascular strain and restores a healthier hormone rhythm.
Picture a typical day of low estrogen living. You sauté breakfast without seed oils, sip filtered water from a glass bottle, pack lunch in stainless steel, and unwind with fragrance-free moisturizer. Small actions that together reduce estrogen load.
Checking progress is straightforward. Many labs now include prolactin testing with routine panels, so adding it is a simple box to check.
Cardiovascular benefits accrue quietly. Lower blood viscosity means less shear stress on artery walls, while balanced hormones improve mitochondrial function, translating to steadier energy and clearer thinking over time.
Remember, the window of highest sensitivity sits between your mid-30s and early 50s. Taking action during those years provides the greatest payoff. Yet, it's never too late to start reducing estrogen dominance.
If you're contemplating surgery today, demand a thorough exploration of non-surgical options and ask how preserving the uterus or delaying the procedure might impact long-term heart health.
The central message is empowerment. Understanding the interplay of hysterectomy, hormone balance, and cardiovascular disease positions you, not statistics, to steer your future well-being.
Before we close, here's your challenge. Over the next 7 days, eliminate seed oils from at least one meal each day. Replace 2 plastic items with glass or stainless steel, and arrange a prolactin test. Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.